and I'm one of the co-chairs for the Bridge Research Network. Thank you for coming, and it's lovely to see you all today. So today we'll be going through, I'll do a brief introduction of Bridge Research Network, and then I'll hand over to Anna to do a teaching on clinical questions. Then we will talk about our upcoming events, and we would ask you for feedback. Your feedback is really important to us because it helps us to shape our programs. It helps us to make sure that what we offer is useful to you. And I think this time around, we might also be asking you about the timing as well. So as a network, we were set up because we realized that in Yorkshire and Humber, there is very little research opportunities available to trainees. And this is a network that is run by trainees for trainees. Our aim is to bridge the gap in trainees' access to research. And we do this in a number of ways. That could be by advertising upcoming research events, or even signposting you to someone in your local hospital who can help you dip your feet into research. And then we'll provide these sort of educational opportunities. There is also an opportunity to do a journal club, which we would welcome any trainee and consultants pair. If you're not a trainee and you're a trust grade doctor, we will still welcome you to do a journal club. We try to vary the specialty every other month. And then we hope to become a platform where we can have multi-center regional audit, QIP, and research. So we are hoping that this year you would hear more from us, and we would also hear as well from you to be able to shape our program and make it better for you. So today we have the honor of having Dr. Anna. She's an ST8, a very lovely colleague I've had the pleasure of working with at Hull University Teaching Hospital. I met Anna during my out of year program where she did a work on neonatal breast milk, as well as just trying to improve our neonatal ODN. She comes with a wealth of experience having worked in another region. Anna today will be talking us through clinical questions for the e-portfolio, so how we can formulate clinical question and other things we can do as well to get some research activity for our portfolio. So I'll, at this point, stop talking and hand over to Anna. Anna, thank you.
Thank you. Thanks, Diane, for that. Yes, let me just get my, share my slides. And I'll get going. I had a look this morning at some of the previous speakers that you've had, and now feel very out of my depth. But hopefully, I can share something helpful to, if nothing else, to make you feel more confident and more on top of your e-portfolios, which are a bind. Can you, if I do that, can everyone see? Can you see my slides?
Yes, I can see your slide.
Yes.
Fantastic. If I'm looking at my slides, I can't see you. So Diane, will you keep an eye out if there's any questions or hands up or anything and give me a yell?
Yeah, that's fine. I'll do that. Thank you.
Fab. So as I say, this is unlikely to be anything groundbreaking, but hopefully what we can go through is a bit about the clinical question development log element of the e-portfolio, and talk a little bit about how to use this to its best advantages and for your best educational outcomes, and which elements of the curriculum most lend itself to this sort of a development log. And then if there are any other portfolio related questions, we can talk through that and hopefully be more of a discussion around these rather than just me telling you things, because you probably know most of the things that I do. As Diane said, I'm ST8. I'm currently doing general paediatrics at Hull Royal, and Diane and I work together there. I graduated many years ago from Liverpool University, and as Diane mentioned, I started my training elsewhere. So I started in Mersey and transferred to Yorkshire in 2019. And I've been a less than full-time trainee for the last 5 years. I had a year out of programme last year for the Future Leader programme when I was working for the maternity and neonatal system, attempting to do some regional QI work with mixed success, but learned an awful lot along the way. And I would highly recommend the Future Leader programme for anyone who hasn't already done it. It enabled me to also do a PG Cert in health professions education. And having been a PEDS trainee for 13 years, I've seen many versions of the training e-portfolio. I'm not so old that it was a paper portfolio when I started, but I think every version of the e-portfolio I have seen. So many things have come and gone and changed. And actually the clinical questions bit of the e-portfolio is relatively new. And that's what we'll focus on today. So first and foremost, I would say that these are one of the easier elements of your e-portfolio to complete because they come up so often in our clinical work. So from the very broadest terms, when you're thinking about these, is just to stay curious and be opportunistic when these things come up. So we encounter clinical uncertainty all the time. And these are what you can use, these little areas of uncertainty, to formulate your clinical question. And the way that they suggest, although you don't have to, is to think about it in terms of your PICO questions, so your patient population, your intervention, your comparison, so what the alternative is, and then the outcome that you're looking at. And when you're looking at your portfolio, it's this little one here that I've highlighted that you're filling in. I've not gone through the whole process because I feel like you all know what your portfolio looks like. But when you've got your clinical question, you then want to find your answer. So thinking about where you're going to look for your literature. If it's something that's quite common, Cochrane might have done a review for you, which will save you some time and effort. Otherwise, I like PubMed as a basic search engine because that can often help show you very broadly what's out there. And then if you need to refine it, something like Ovid, which is a great tool for thinking about breaking down your clinical question into its component parts and whittling down the evidence base to just what's relevant to you. And think critically about the source of information that you're looking at. I'm sure you're all aware of the CASP checklists, but if you're not, they're a really great tool for critical appraisal, and they have toolkits and checklists for all different types of research. And these are great for breaking down the research into its component parts and helping you think about the quality of that research and its relevance to the question that you're asking and your specific clinical question. And then hopefully when you've looked at some papers and been able to compare some research and think about the quality of that research, you've got an answer to your clinical question. Sometimes it's really straightforward, sometimes it is more nuanced. More often than not, particularly in certain subpopulations, it's a bit more nuanced, and sometimes there won't be enough evidence to answer your question conclusively, but all of this is useful and educational. And I thought, having spent some time quite recently going through my portfolio for ARCP purposes, I thought it'd be useful to just highlight the particular areas of the curriculum that this is most applicable to. There's lots of key capabilities that really lend themselves to the clinical questions and give you, because they're broad, they give you the freedom to go down those little clinical rabbit holes and educational rabbit holes to find out what your learning needs are, which makes the portfolio work for you rather than the other way around, which I think is always the way to have it. So particularly things about investigating and managing children and young people, whether that's inpatient or outpatient settings, and also about providing advice and guidance to other professionals, children and young people and their families. And I think this is possibly less obvious, but a great opportunity for looking at things like qualitative research. Thinking about this had then led me down a little rabbit hole thinking about communication and research into communication in paediatrics. So there's lots of ways that you can bring clinical questions into advice and guidance. That's just the general paediatric curriculum, but obviously if you've got a SPIN curriculum, there'll be loads of areas where these clinical questions are relevant. And then more specifically with the progress curriculum, the most obvious areas, again, I mentioned about communication, which is a really nice way of bringing qualitative research in. So this might be related to managing consultations, communicating diagnoses and prognoses. Although having said that, most elements of the curriculum you can kind of crowbar these into, but this I think is a really good one for using clinical questions to provide evidence for. The most obvious in terms of patient management, because that's often what we're looking at, is that there are clinical uncertainties in patient management, and that's where your clinical questions are arising. So any of these key capabilities about diagnosis and treatment, about flexible, holistic, reflective, evidence-based practice, because that is in essence what we're doing here, is that you have taken a clinical situation, reflected on it, identified uncertainties, and then looked at the evidence base to guide your practice. So that is, I think, kind of the most obvious in the curriculum of where these fit. And in research as well, because we're practicing evidence-based medicine, that is what we're, by going away, looking at an evidence base and using it to guide practice, that's exactly what this is. So, and then I thought I didn't want to present kind of going through the whole literature search and everything like that, but just so a very quick example of one that how this might arise. So on a ward round on the neonatal unit, a preterm infant who's on some caffeine, they're still having episodes of bradycardia and desaturation. You think they're probably having apnea of prematurity, and there's a discussion about what to do with their caffeine. Should you increase it in just the dose, or should you give them twice daily dosing? Which one is better? And this was a real discussion that I had with a consultant on a ward round as to, do we give them one big dose or two smaller doses? Which one's going to be better? Instinctively, we felt we knew the answer, but there was no guidance on it. It wasn't part of our guidelines. So formulating that into a PICO question, our population were preterm infants. And again, you could refine that further by defining what gestational population you want. So do you want to just look at extremely preterm infants or low birth weight infants, or what? Our outcome was episodes of apnea and bradycardia. Our intervention is caffeine citrate in 2 divided doses, and our comparator is once daily dosing. And so going away and having a look for information about this and research on this brought up a whole host of papers and research of varying ages. So again, thinking, how old is this study? What's the number of infants included? Is this big enough to extrapolate information from? There were lots of studies looking at really big dosing of caffeine, so not relevant to our study population, because we would never, we don't use dosing of caffeine in sort of 40-60 milligram per kilogram doses, so got rid of all of those, and was left with basically one quite small paper looking at the question that I was asking, so once daily versus twice daily dosing. And the short answer was no, that actually once daily dosing was better than 2 divided doses. And that's always quite nice, because then you can go back and say, no, we should just be using once daily dosing here. And that can then lead to things like, well, do we need to change our guidelines on this? How do we share that information with the local team and beyond? So at this point, I thought I'd turn over to you guys and see if you can think of recent experiences or areas of clinical uncertainty that could lend itself to a clinical question, and then formulating that into a PICO question. So I don't know, there's, oh, the group has grown while I've not been looking. Can anyone share any experiences of using these clinical questions in their portfolio, or I suppose now would be a good time for questions if there are any, or if you can share something that might lend itself to this.
I think I'll break the ice and then hopefully more people can speak up.
Thanks, Diane.
I remember seeing a child who's coming on the ward. There was a diagnosis of reflux and they were on omeprazole, but now at this point, they had like pink stained substance in their vomit, which initially we were like, can this be blood? But didn't quite look like a blood because it was just like clump and there were no streaks at all. And we got thinking, mom said, oh, she went to Dr. Google and they said it can be due to the omeprazole dose. But then we've never heard of that. So it was more like, oh, we need to have a chat with the pharmacist. And the pharmacist said, yes, there are some reports about that. So we now had to formulate a stuff clinical question and we went searching online. And yes, there were actually some reports about that happening. And it did tell me with about the age, like how many days a child had had the medication. And so we just went back to mom, did some safe, like check for red flags, there were none, did some safety netting advice, and mom could go. But for us, it was like a new, that was for myself and the consultant, it was a new learning that we had done, and that went on for a clinical question.
Yeah, and that's because that's something that's totally new. It doesn't necessarily, that's not a very easy one to put into your PICO, but that, I don't think that matters because it's still a really relevant clinical question. And not everything is going to fit neatly into a, is there an intervention and a comparator? What you're looking for there is, what's the evidence on this in order to provide the right information and guidance for this family. Yeah, some of the other things that I had come up with. So as I was looking through in preparation for this, I went through the curriculum to try and find, well, how could I put a clinical question that would fit with this? And some of the communication things, again, didn't quite, you can't really make those into a PICO question. But again, I'd had a situation at work where I was needing to give some bad news to a family, and afterwards was thinking, well, I don't know how well I did that. I wonder if there are any tools or that are relevant specifically to pediatrics, because obviously when we do our communication teaching and learning at university, it's broad and largely adult based. So I went away and had a search and found some really interesting articles about pediatric breaking bad news, which again doesn't really fit with a population, an intervention, an outcome, but still would fit with the clinical question development log in the portfolio. Anyone else got anything that they might?
If people could put things in the chat box,
Yeah.
what's your difficulty with clinical question? Are there times when you've struggled to actually find the answers online, and what else you've done regarding that? It would make this session more useful. Thank you. Or if you want to speak, yes, please, you're welcome to.
So yeah, the thing I'll say was,
oh, sorry. Yeah, I was just going to echo exactly what you were saying about sometimes the challenges of shoehorning it into a full PICO framework, in the sense that, you know, one thing I was looking at recently was the use of bicarbonate in persistent pulmonary hypertension of the newborn. And you're essentially looking at a population that's very sick and is often having a quite active management, with changes to the management occurring all the time. The idea that someone's definitively answered that question inside a PICO framework is really quite challenging. And so I ended up just using a lot of reviews into the use of bicarbonate in neonates. And that's a bit more challenging, but I still logged it in the portfolio, and I think as long as, you know, you describe it well enough, then it can be still quite a good entry that shows you're pursuing evidence-based practice.
Yeah, absolutely. And I think that's one element that's really important, is that you might find that there isn't any evidence out there, or certainly that there isn't any evidence that directly answers your question. And that's then when you can ask yourself, well, do I need to widen my net? So if there's nothing that talks about the neonatal or pediatric population, whichever one you're looking at, do you need to look at adult data? And then you have to be really careful about extrapolating that. But again, that's all really important reflection to say, well, can we extrapolate this from adult data or not, or do we need to start from scratch? And that leads beautifully into then things like next steps. So when you find a gap, is that a gap that you can plug? Sometimes it can be really straightforward things. So particularly from a qualitative research, you might find that there isn't a neat answer for what you're looking for out in the literature, and you might think, well, actually I could potentially do that, in which case finding a supportive supervisor or somebody who's got interest in research, or a consultant who you know has been published before, can help you to get onto the right roads for that. And again, we've got in Yorkshire, we have the beauty of having Bob Phillips, who puts together the Archimedes, and is a really useful person. I have been told earlier on in my training when I moved to Yorkshire, he's a great source of information for telling you fairly quickly if your idea for publication is a non-starter or not. And that's Archimedes is essentially a beefed up version of our clinical questions. So if you go away and do a really good literature search and literature review, then submitting it to archives for publication in Archimedes is a really good next step, and a really a slightly more straightforward way of getting a publication and getting your name out there as an author. As Diane was saying in the introduction, these are great to bring to journal clubs. If you've gone away and looked at something in quite a lot of depth, then keeping that information to yourself, you need to share it. So doing that in a journal club is really good. And as I said before, these are great opportunities to getting your foot into research. So having your GCP up to date, so that if there are research opportunities, you can leap on them. And there's a link on the BRIDGE website to the systematic review e-learning from the Royal College, which again goes through things like literature searching and critical appraisal of data, so that you can really effectively use these clinical questions.
There is some comment, Anna, before. There is some comment in the chat. It's about we face situations every day when we have clinical questions and we will be questioning ourselves, but I haven't thought about putting this as a development log in a portfolio before. I think one of the examples was when we question ourselves about dexamethasone versus PRED in wheezes, or what dose of dexa we should give in a wheezer. And I think I relate to that because I realized when I moved from one hospital to the other, sometimes you get told off for doing things in a certain way. And there is no evidence. Why do we do it this way? It's just the way it is done here. And I found those situations as useful situations to actually go back and search, is there any advantage of doing this way compared to this other way, and see if there's something that comes up in the literature. Sometimes there is nothing, and I just know that, fine, this is just what the unit does. Sometimes you're pleasantly surprised and there's something that comes up and you're like, oh, yeah, okay.
Yeah, and I think that yeah, again, having rotated many times, that sinking feeling of, oh, this is just how we do it here. And you think, yeah, but why are we, you know, we're all working from the same evidence base, why are there these huge variations in practice? And if you're able to go away and do a clinical question, so say wheezing, looking at the dose of the use of prednisolone versus dexamethasone in wheeze. I know a consultant that I work with in Liverpool felt very strongly about his preference for dexamethasone, and that, again, because I trained with him a lot, that came with me across when I moved to Yorkshire. Nobody uses dexamethasone for wheeze, or as far as I'm aware, I've never worked anywhere in Yorkshire that does. So that was something that came with me. And looking then at the evidence, you think, well, if you can find strong evidence to suggest that practice ought to change, then you can be instrumental in service change and guideline updates, all of which look really good in your portfolio. And when you finish, are things that you will be asked about at consultant level interviews. So being able to demonstrate that you've had some evidence, you know, you know how to search the evidence base, you know how to critically appraise papers, and you've used this to change practice in your area, are all things that then look, not only are useful in your e-portfolio to evidence your training, but are also really useful then to talk about when you're getting to the next level. Yeah, so Ahmed shared about in neonates, non-invasive high flow oxygen post-extubation and the risk of pneumothorax compared to CPAP. So yeah, that would be a brilliant, you could put that quite easily into your PICO, thinking about, so preterm infants, post-extubation, CPAP versus high flow nasal cannula oxygen, and your outcome being the risk of pneumothorax. Yeah, and I think because there's so many elements to the portfolio, these clinical questions that come up, because they come up so frequently, they do lend themselves to an easy way of evidencing your training. And I think the other thing I would then say about that is make sure that you're getting your SPA time, and that it's because these don't all have to, you know, you don't have to spend weeks doing literature researches for these. They can be quick, just a quick search through the literature. Are there any relevant papers? Which one grabs your interest? Look at that one. They don't all have to be massively in depth, but these can be used to cover a huge range in your portfolio.
I don't know about other hospitals, but something I found really useful was the first time I had a very big clinical question and I had done a search and I wasn't getting so much back. I sent an email to the library unit and they were so helpful. They did a really good search for me. They highlighted the top articles they felt I had to read in great detail. And that clinical question led to a case report, which was published in the Infant Journal. So sometimes you actually go looking for something little, but by the time you involve the librarians, you realize that you can actually do something, you know, you can plug this gap. And I think coming from like someone who didn't have a lot of research experience before my training, as a father, I know that bulk of my XT1 people were like, oh, clinical questions are dead easy. But I just couldn't think of things to put on my portfolio. So something that helped us reading, you know, the archives and seeing something that someone has raised a clinical question about. And I watched one of the RCPCH videos and they said, oh, you know what, if you spent your time reading something in a journal, you can be able to create a clinical question out of that and put that in your portfolio to show that you've actually spent time reading some research materials. I started with that before I got the confidence to be able to do a PICO. And once I did one, I realized that there are lots of PICO questions around us every day. It's just about the time to create something.
Yeah, hang on. Yes, I was going to mention using your, sorry, my mute button's gone all funny. Yes, I meant to mention about using your library team. There will be, every trust will have somebody in the library who can help you with these sorts of things. And they are really knowledgeable. And as Diane said, you can tell them what you're looking at. They can either show you or help or do the literature search for you. And they're a really great resource for helping you get into the literature, get into the evidence base, and highlight what you should be looking at. And then you can use things like your CASP toolkit to look at the individual papers that they highlight. And yeah, this is a lovely way to get publications, because once you've done the work for your portfolio, you've essentially done the work to write up a case or to write up a case series or a literature review. And I think having supportive colleagues, having a supportive supervisor that can kind of help or to proofread or whatever is really invaluable for getting yourself out. Neil, have you got your hand up?
Yeah, I was just going to say the points, thinking about, other examples. You can often find that you've asked the wrong question, or particularly you've asked the wrong comparator or the wrong outcome measure. Like a good example would be if you're wondering about, what's best to close the duct in a neonate, and if you did a PICO question about that and your outcome was closure of the patent ductus arteriosus, then you'd probably come to the conclusion that indomethacin is the way forward. But during the research for that, during looking at the research for that question, you'd appreciate that whilst closing the ducts is most effective in indomethacin, then it's not actually beneficial to the 2-year development of the babies, and there are also significant side effects that mean that we don't use it anymore. And that's okay. You don't necessarily even have to change your question, because you can then just put that reflection within your portfolio that you've learned that the other aspects of treatment mean that your clinical decision is actually slightly more complicated than just saying A is better than B.
Yeah, yeah, you're absolutely right. And also, you as you said, you might find that your question changes as you look at the research, and that you go back and revise your question once you've done a bit of reading around a subject. And as I said at the beginning, what I quite like about using these is that you get to answer the questions that are relevant to your learning, because you'll find as you go through that you pick up bits of information as you go along. And these clinical questions just kind of let you go off down that rabbit hole, and that might take you in different directions to where you thought you would go, as Diane mentioned, with something that she thought was a quick question would be an easy question to answer that actually ended up being a whole much bigger thing that led to a publication. So you might find that that changes as you go through, and that in itself is a useful reflection, because it shows that things are not always straightforward and there might be nuanced answers. There was a question about how to get in contact with archives and journal club and things. So I think in Archimedes there is an email address in the section of the journal if you've got things to get in contact with. And in terms of journal clubs, so obviously there's BRIDGE that is hoping to introduce things like journal club, but if your trust has a journal club or a continuing medical education, so I know at Hull they have a monthly clinical medical continuing medical education. So if you've come up with something that's useful or that's been particularly interesting, then getting in contact with whoever organises your education in your local trust. If you haven't got a journal club, set one up, because then you've ticked off loads of things in your portfolio and done something really useful for your trust. So organising a journal club either within your department or wider if it takes off, but even if it's just a local journal club that you present on a monthly basis or something like that, then that's a really useful thing to have established, and is a great way of spreading evidence-based medicine and research and an awareness of critical appraisal of the literature in your department. So if you've got a journal club, use it. If you haven't, consider setting one up. And as I said, I think from an Archimedes perspective, I think there is a direct email address that's in archives.
I've just put in the chat box the CAPS checklist for anybody who is interested, as well as the feedback from, yeah.
And again, in terms of getting more involved in research activities, your department may have specific paediatric research nurses, specialist nurses. It's always a good idea to get in contact with them. Very often we don't get, I think as paediatric trainees, we don't always get many opportunities to get involved locally in research because I think partly because of the rotating nature of paediatric trainees, it's just not something that trusts try and get us involved in. So if you find out who your local research specialist nurses are or your local research team, you can then get in contact with them and say, I've got my GCP, what research is going on, how can I get involved, can I be on a delegate list for things, whether that's involvement in terms of consenting participants or having more involvement, or just getting some broad experience so that you can decide whether it's something you want to take further. And again, from a finishing training perspective, involvement in research is something that is useful to have at least a very basic knowledge and understanding of, and even if it's just very peripheral involvement, showing some involvement in research is really useful for your next level of applications. And from a starting point, that might just be getting in touch with your research team and asking if you can be on a delegate list and do some consenting or randomization for studies that are going on. Diane, have you got anything else that you might add from a local research opportunity?
There is also the API, which most times in the East is on that field. They have slots to be able to have people come on as associate principal investigator. I know most of the researches are neonatal based, but it's still a great way to get your hands on some research experience, and then you can decide if you think research is for you or not. Well, yeah, please do get in touch with the research nurses. They have a lot going on, and they're always happy to put you through.
I think the other thing is about keeping your ear out for people that you work with or people within your network who have been more heavily involved in research. So if you can identify those people, then they can be your useful base for saying, well, actually, I've got this question that I don't think is really answered in the literature. How do I go about taking that further? I think that's that is probably easier to do when you're in the tertiary centres compared to district generals. And again, I sort of knew people back from when I worked in Mersey that would have been my go-tos for those sorts of things, and I don't have that network in Yorkshire. but asking around who is in this network that has been involved in research and might be somebody that you could take things further with, and your research nurses as well are a good place. And Diane's shared
Thank you so much, Anna.
some link.
Thank you so much, Anna. It's been lovely having you on today. Guys, on the screen is the feedback, and I hope that following this session, we can feel brave enough to start putting things down on our portfolio in terms of clinical question. If there are specifics you want to know about and maybe you don't feel comfortable asking in the general forum, please, if you drop us an email, we will make sure to pass your email on to Anna. We would ask that please, welcome. We would ask that please you give us a feedback. That's our way of being able to structure our upcoming events to suit what interests you. But apart from that, we want to let you know about what's coming up next. On the 13th of February this year, we have Professor Will coming on, and he will just talk to us about writing book chapters, how to find opportunities for this. And in March, we would resume our journal clubs. If you're looking for past episodes, past sessions for our research group, if you visit our website, you'll be able to find all our recordings available there. But that's it. Now we've come to the end of this section, and I want to say a big thank you to Anna for your time and sharing your wealth of knowledge, and to you who has come on with us today. Thank you as well. Thank you.
Oh, thank you so much for having me, Diane. I hope it's demystifying e-portfolio